please state your full name?
Paul Kirkpatrick.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty
that the evidence I shall give
the evidence I shall give
shall be the truth,
will be the truth,
the whole truth,
the whole truth.
and nothing but the truth.
Paul, you have severe haemophilia A, which was diagnosed in childhood. Is that right?
Yep, that's correct. I was born with it, so my brother and cousin were also severe haemophiliac, so as soon as I was born I was tested and came out severe.
And your brother Des is the brother that you've mentioned, and he was diagnosed in childhood in the same way that you were.
Yes, I think almost at birth he was diagnosed as well, because my cousin was a wee bit older, so it was in the family line, as they say. So.
Now, you started receiving factor VIII products in 1976 when you were about 10 or 11 years old.
Yeah, I would have been 10. I was 10 at the time.
I'm going to ask to have put up on the screen, and it should come up on the screen in front of you, Paul, a document. Paul, it's 1333004. And if you look at this document, Paul, you'll see it's dated the 15th of September 1976, and it refers to you commencing home therapy in May 1976. And we can see that in the period between May and the 6th of September of that year, you received treatment with factor VIII products on 19 occasions. And then if we look at the third paragraph, thank you, we can see that you were seen again in September, the dosage was recalculated, and that you were given more home therapy treatment in the form of cryobuline factor VIII from that point. Is that right?
Yep, that's correct. I say myself, my brother and another guy in the room, we were the first three in Northern Ireland that started home treatment. So I transferred from the Children's Hospital at that stage, where Dr. Bridges was my clinical doctor in charge about the age of 10, and we transferred over to Dr. Main at that stage in the main hospital, and we start home treatment then.
Now, do you know what, if any, information was provided to your parents, or indeed to you as a child, about any risks associated with the products?
Okay. Well, bear in mind I was only 10. I was probably more interested in Liverpool than I was haemophilia at that stage. But what I recollect, and obviously my parents would have been told a lot more, is that this was a massive jump advantage for us in that we wouldn't have to go into hospital. So as a child, I spent a lot of time in the Children's Hospital. Not very good times. I can still have flashbacks of memories of having to stay in hospital and whatever. So we were very much tied to the hospital. My mother wouldn't work. She had everything set up in case we had to go to the hospital in a rush. And she worked with the schools and such like, so that I could get treatment when I needed to. So we were very much tied to the hospital. Couldn't really go on holidays too far away from a major centre. So we never never went outside Ireland and that kind of thing. The home treatment, when it came, was there to open the doors for us. It was there to lead more independent lives, to be able to get on with your own life, to be able to treat yourself the minute or even before you may have suspected a bleed, and to minimise the inpatient stays in the hospital. So it was brought, all the positives were there, and there's no doubt it brought all those positives. I'm not aware of any risks that was presented at that time.
Okay. Paul, could I ask you to move?
Just a moment. I wonder if you can move the microphone a little bit nearer to you, or your chair a little bit nearer to the microphone.
Right, is that better?
I've just been told that some people can't hear as well as they should.
Okay.
Thank you.
Thank you very much.
Paul, in your witness statement, you've said that your parents were told that factor VIII was a wonder drug and that they had nothing to worry about. Is that something that you recall being told, or is that something your parents have told you that they were told?
I think it's more what my parents told us that was told to them. And for those reasons I mentioned before, they were a lot of positives going on home treatment, and still is.
And it's right, I should say, that Dr. Main, who was your main treating doctor at this time, and who, as you know, has provided a witness statement, has said that it's unlikely that she would have used the phrase wonder drug, but you don't know who might have used that phrase to your parents.
No, I think Dr. Main was the sole person we talked to at that stage, so I say it was presented in the best possible light. So. But I say I was 10 at the time, so I can't stand over everything.
Now, as I understand it, you continued to receive Factor 8 products over the following years. And your wife's statement has recorded that in the 1980s you were told at one point that you were the highest blood product user in Northern Ireland.
Yeah, I think around about the mid-80s, you saw some when I was only 9 or 10, I was using quite a lot. In the mid-80s, I went through a particularly difficult period with elbow bleeds, and I used a lot of Factor 8 and that. So. Now,
your statement reports that at some point in the mid-1980s, you've said around 1983, 1984, when the AIDS scare was rife, there was a meeting at the Royal Victoria Hospital. What can you recall about that meeting?
Okay, so I remember Dr. Main called a number of us in, I can't remember, but maybe 6 or 7 people. I think she maybe took people in groups and explained about the AIDS stuff. Most of the information was coming through the Daily Mail at that stage, because it was more in the press than there was through the hospitals at that stage. But she called a group of us in and explained that they now had a test, so it took a while for a test to even be developed to check if you had AIDS, from my recollection. And she brought us in, explained that they were going to test us for AIDS, and they would come back to us as soon as they can. I recollect it wasn't a short time frame, but it wasn't, I think it was maybe a month to 2 months or somewhere like that there before we were brought back and told the results of those tests.
And in your instance, the result of that test was you were advised you had not contracted HIV?
That's correct.
Can you recall anything about your reaction to that meeting and the information that you were being given about this possible risk and the need for blood testing?
Okay, so relief. To be honest, the first thing's relief. That possibly missed a bullet, so I was glad of that. I was 18, 19 at the time, so I started university. I was trying to look forward to life, so to have this weight taken off your shoulders was massive, because there was a lot of stigma everywhere. We kept it all confidential within the group. You wouldn't openly discuss it outside a family group because there was a stigma, and at that time, the 1980s, HIV was related to the gay community and such like, and it was all bad press. There was absolutely no balance to it. So the fear was, and I've always been personal about my own health, that if you went out in public around it, people would misinterpret stuff. So you really had to keep it internal. You had to internalize it all. So that's what I did. But as an 18, 19-year-old, it was a relief to move forward.
And then you continued to attend routine clinic appointments at the hospital. And in your statement, you've referred to a conversation you had with Dr. Main in or around 1987. What can you recall about that?
Which one's that referring to, the blood products?
So in your statement, Paul, you've said that in or around 1987, whilst attending a routine clinic appointment, Dr. Main very casually slipped into the conversation that I had contracted non-A, non-B hepatitis.
Yep.
What can you recall?
Yeah. So obviously, I describe these as clouds. The clouds come over, and the first cloud was the HIV, and it blew away. And then you thought everything's okay, everything's hunky-dory. And then the doctors started mentioning that there was a non-Hep A, non-Hep B detected in my blood. But and that was it. It was just slipped in. We didn't know anything about it. There was no further explanation. I got the feeling, I still have that feeling, that they really didn't understand too much at that stage about it. So because the doctors, they gave us no information because I don't think they knew enough about it themselves at that stage. And that was my perception, at least.
Were you given any information at that stage about any prognosis or longer-term risks or risks of infecting others?
Yep. So we were told, I'm not clear in the time frame because it evolved into, and I joked about, they've a creative name for it, it's Hep C. From non-Hep A, non-Hep B, it's Hep C. So we joked about it, having a lack of creativity in naming this virus. But what I remember was I was told, don't worry about it. You've probably had it most of your life. It hasn't impacted you, and you'll not impact anybody else. And that stuck in my head because, you know, Dr. Main was an excellent doctor for every patient will say they have her up on a pedestal. And when she tells you something, it stays in your head. And that stuck in my head to this day. That Dr. Main told us we're safe. There's no risk of transmission, and it probably wouldn't impact me because I've had it for years.
Do you recall another conversation you had? I don't think your statement tells us whether it was with Dr. Main or with somebody else, but a conversation about factor products. You were told there was factor 8 which was safe and clean and another which was potentially contaminated.
Yeah, that was scary, and in hindsight even more scary because demand was greater than supply for the blood products, and it was quite, the conversation was quite open with the doctors around stuff, and what the doctors came to, they were continually trying to bring in as quick as they could the heat-treated factor 8, and then following later on in years the recombinant factor 8, but you can imagine it's a slow process. These things just don't happen overnight. So one stage, I remember vividly, and I think my wife was with me at the time. So she told us, Dr. Main said, we have some products, we have a limited amount of heat-treated factor 8, and we have the standard factor 8, for want of a better term, that is possibly contaminated. And because you've already been infected, we're going to continue to give you the potentially contaminated factor 8 because that was always there at the time. So I think in hindsight, if you think on it, at the time I know my wife and I actually thanked the doctor for that. I think now you reflect upon it, maybe we shouldn't have done that. But in hindsight again, what other viruses could they have been carrying that we didn't know about? And obviously vCJD evolved in later years. So we're continually being put at risk with product that was potentially contaminated.
Just picking up this particular conversation that you recall having with Dr. Main, Dr. Main in her statement has said that she told you that you'd received unheat-treated concentrate once in the past. And she then refers in her statement to that batch testing positive for HIV, but you remaining uninfected and would therefore be safe if you ever had to receive such material again.
So that's news to me. You told me that an hour ago, and that shocks me because I never heard that in my life. And if I heard that, you would remember that.
So you recall the conversation that you've described in your statement about there being products that were safe and clean and others which might be contaminated, and you were going to be given potentially contaminated products. But your recollection is, your evidence is that you've not previously been told until Dr. Main's statement's been explained to you this morning that the batch you had received or a batch you had received had tested positive for HIV.
No, that's news to me this morning. I always wondered, because we mentioned before about I had quite a lot of treatment in the peak of this period, and I kept saying I was lucky I missed it. So maybe my body was smarter than my head, it rejected it, so I was lucky.
Now, you've described this meeting in the mid-1980s when you were told that your blood would be tested for HIV, and you understood, I think, that that was the purpose of the test that was being done on that occasion.
Yep.
But you've also said more generally in your witness statement that you believe you were probably tested on other occasions without your knowledge and consent. What's the basis for your belief?
If you go back to that first letter you sent in 1976, so I just started, and from, I can't remember, it was from Dr. Main to Dr. Britt, where it states, I think in the very first line, that my liver enzymes had been raised and that there would be viruses tested at that stage. So I suspect from the minute I started that home treatment that I was being tested for viruses, whatever those viruses may or may not have been. But again, until I got my notes in the last number of months, that was news to me.
Now, again, it's right I should point out that Dr. Main in her statement says that there was no testing for HIV before the early part of 1985. In terms of testing for hepatitis C, you've explained that you were told by Dr. Main, first of all, that you had non-A, non-B hepatitis, and then sometime later it was described to you as having hepatitis C. Do you recall whether you gave consent for your blood to be tested for those viruses?
No, it was just done as routine. What I believe was routine at the time, to look at the effect on your liver and subsequent viruses or whatever. So obviously the medical people knew more than the patients, so they knew what to test for, and as history will reveal itself, is that was well documented and known at the time.
Now, you've subsequently learnt that you'd also been diagnosed with hepatitis B. How did you find that out?
I can't recollect strongly. The Hep C was much more stronger recollection than the Hep B. I think I remember saying we need to give you a vaccination for Hep B because you've contacted Hep B. But again, it was just superficial, and to this day I haven't Googled it, so I don't look into the Hep B. But at the time I remember getting some sort of vaccination, and going through my notes you can see that I was vaccinated, and they mentioned getting revaccinated every 5 years, but it wasn't prominent in my mind.
If we look at, please, on the screen, 1333003, please. This is a letter to you. It's only part of a letter, and if it's dated the 8th of December 2000. Sorry, it's not a letter to you. It's a letter to your GP.
That's correct.
And if we could just go to the third paragraph, please. At present, he requires a review of his hepatitis management. He is hepatitis B and C positive. In your statement, you've said that you were unaware that you were hepatitis B positive throughout this time until you received your medical notes in the last few months. Is that right?
Yeah, I saw it in my notes, and just totally unclear about it because hepatitis B wasn't mentioned, or if it was superficial. So until I went through those notes, I wasn't aware. And when I read it in the notes, I said I didn't realise it was Hep B. Then I went back in the notes, and it mentioned I was given a vaccination. So I have a cloudy memory around that Hep B discussion, but it wasn't prominent. I have a lot of things stuck in my mind, and that wasn't one of them.
Okay. Now, your statement explains that despite the diagnosis of hepatitis C, you felt for a period of time remarkably healthy. But that began to change, in particular when you started in around 1999 to receive treatment for the hepatitis.
That's correct. Yeah. So I pride myself, and I was pretty for haemophilia. If I didn't have haemophilia, the rest of my general health was pretty good, and I was proud of that fact. And I tried to maintain my school. I tried to maintain university attendance at that. I would rarely try and miss anything. I would go to school with plasters. I used to have plasters on my feet. I used to have slings on, but I still always went to school and university, and I forced myself, and my health was generally good.
Now, you, in around 1999, you embarked upon the course of interferon and ribavirin. What, if any, side effects did you experience from that treatment?
Okay, so that was probably one of the most difficult periods in my life. I I don't complain. Anyone who knows me will tell you I don't complain. I don't openly tell people if I'm in vast pain. I'll lock myself in the house and no one will see me. But this period was very different. I started the treatment and I started to get very tired, diarrhea, and what was it? A lot of fatigue, diarrhea, and sort of chest pain, not feeling generally well. Very down and depressed and difficult to manage simple things. So it was I started to lose weight. It was a very difficult time and just absolutely miserable, to be honest, while I was on that treatment.
If we could just look at one other document, please, Paul. It's 1333005. And this is a letter dated the 25th of January 1999. Again, it's a letter to your GP. If we could look at the third paragraph, beginning prior to starting any treatment, it says here, I've emphasised to Paul that he's very well, he's not at risk of infecting anyone, and that the proposed treatment without alpha interferon and ribavirin is purely protective for the future. So do you recall what discussions, if any, there were about whether you should embark upon this treatment?
I think we were encouraged to take it. We were said there could be not nice side effects, but that was it. But the encouragement was it's a good idea to take it as it says in that statement, to protect you for the future. Didn't really elaborate on it because at that stage in 1999, and I go back to what the doctor told me, that Hep C, you probably had it all your life. It hasn't affected you, therefore don't worry about it. And I say that's emblazoned in my memory. So we've given very little guidance besides there is some side effects, but it's worth giving it a go for the future.
And in terms of the side effects, you've described the bowel problems, the diarrhoea in your statement, that you became very tired and depressed. You've said in your statement that your family and friends thought you'd become a completely different person at that time.
Yeah. Yeah, I'm really probably laid back. I used to be quite laid back. Nothing really agitated me. I managed my whole way through life at that stage with just focusing on going forward in life and doing the right things. But it changed me. I genuinely think at that stage that changed me. It became very difficult and probably maybe not the easiest one to live with at the time because it was difficult.
And you, again, in your statement, you've explained that you developed eczema, you developed asthma. Your wife's statement talks about you becoming yellow, developing rashes and losing weight. Yeah. And then you were subsequently diagnosed with a condition called sarcoidosis. What was that?
Okay, so that was in 2005. I was a lot of chest issues, coughing continually, struggling to breathe, and I went to the GP. So I went to the GP and he did a test. I remember him testing me, I can't remember exactly the test, and then I got a phone call the next day from the GP to say that he had red flagged me to the hospital and that he had concern around that I either had a thing called sarcoidosis or lymphoma, and we needed to get an urgent CT scan done, and that he had spoken to the chest consultant, and this time it's not a different city in Altnagelvin in Derry, and he'd spoken to the chest consultant and that he was concerned. He red flagged me and I went and got the CT scan, and it was very efficient. The doctor was excellent, and about a week later, I think, between the GP seeing me and getting the CT scan, the chest doctor phoned me to say, good news is it's not cancer, it's a thing called sarcoidosis we believe you've got. So sarcoidosis is a lung issue where you basically gather a lot of blockages, crystals or whatever, I can't remember the exact detail, but affects your lung breathing, and I struggled for maybe 6 to 12 months at that stage with breathing issues, with rash was a big thing. Rash started in the rash and breathing stuff started on the interferon treatment, and I've had it forever since. So.
And your understanding is set out in your statement is that there may be a link between the interferon and the sarcoidosis.
Yep, like most, you Google it, like most of us do, and there's quite a lot of documentation there which links interfering with sarcoidosis. Ironically, when I went and got my notes, there was an exchange of letters between the haemophilia consultant at the time and the chest consultant I was seeing up in Derry, and I think the haemophilia doctor was asking the chest doctor what did she think. Her answer was, well, I have no experience, but she went onto a medical website or whatever and produced a document which showed some linkages there. And I say, the more you look into it, there's plenty of linkages there. So a friend of it described it as, so your contaminated blood, and you were given, over the years, then you were given a treatment which then gave you another ailment called sarcoidosis, and your skin problems, and your diarrhea and gastro type issues. So it's just another building block on the way.
And you put it this way in your statement, Paul, the treatment was truly horrendous. I felt flawed, nauseous, and had no energy. And you were absent from work for a significant period, you say, for the first time in your working life.
Yep. I said before, so haemophilia gives you joint problems. It leads to a form of arthritis. So it affects my 2 ankles, my 2 elbows. And I remember in our workplace, there's a long pathway, and I used to walk it no matter how sore it was, how painful it was, and everyone used to overtake me in that path, but I still made it to work. This floored me. It was the first time I had any extended time out of work with this treatment, because it just totally floored me. I would get up in the morning and go and sit in a settee, and within probably 5 or 10 minutes I was just floored again and running back and forward to the bathroom and whatever.
What was the reaction that you've described in your statement of one of the nurses and one of the registrars when you related your symptoms?
Okay, well, that was a disappointing thing, because for the haemophilia community is a small community, and the doctors and nurses outside of your immediate family are the next important people in their lives. So I was going down regularly to get blood tests. My white blood cells were dropping and having difficulty and getting, I don't know how critically low. But when I went in and started to explain to the nurse, I was feeling miserable, I was losing weight. She told me it was my imagination. So that hurt me.
And you've said in your statement you even began to doubt your own sanity.
What? I went home and said, I told my wife what was said. She couldn't believe it, because at that stage, somewhere along that period, my wife was admitted to hospital with a twisted bowel, and she had to get a pretty big operation to sort that out. And her doctor, the operation was in Belfast. I live in Derry, which is about 90-minute drive away. So I was going down to see her, trying to stay at work. And her doctor actually turned around to my wife and says, I think I need to discharge you early because your husband isn't well. So a relatively strange doctor saw the impact on me, and was disappointed when the haemophilia clinic at the time told me it was my imagination. And I say, anybody knows me, I say, I don't complain. The first words out of my mouth is, how are you? I'm grand. So if I'm saying something, I'd like to think people are taking me seriously. So it was quite hurtful. And again, it's another one of those statements that just sticks in your head for the rest of your life.
Now, whilst you were on this course of treatment, you and your wife were trying for a baby.
That's correct.
And your care had transferred or was in the process of transferring. And you've described in your witness statement asking about this issue. What can you recall?
I'm very clear in this one. I can get very angry in this one, because I described how difficult it was, and my wife was watching me go through it, and at the time she went on, she took the batch numbers of the treatment and the drug company and went through the internet at the time and tried to find out more about what it was, how it was affecting me. And when she eventually got to the drug company, there was a warning at the top of the page in bold writing. It was American Drugs Company, I can't remember which one. In bold writing says, under no circumstances get pregnant. Make sure you use 2 forms of contraception, because there's clear clinical evidence that this can impact a fetus. So naturally, that was a blow to the head. It was very disturbing, very concerning. We printed it out. We made an appointment. We went straight down to. We can both recollect the room we're sitting on, the chairs we were sitting on in the city hospital at this stage. And my wife handed the doctor that letter. Said, "Why didn't you tell us this? You know, we're of the age, we're 29 or so, we were married for quite a period of time at that stage. We're of the age where we're trying to have children. Why didn't you tell us this?" So in our minds, both our minds, we can still picture it clear as day that we were never told that, and we actually presented the evidence to the doctor, and she didn't have an answer for us. She just skirted around us. So
Now, you know, Paul, I think that he hasn't yet had the opportunity to provide a response, has been asked to, but a response may be forthcoming in due course in relation to that. But I should show you something in the records, your records, about this. It's 1333010, 10 at the end. So this is a consultation 26th of February 1999, and it says, Paul attended today with his wife for discussionary HCV double therapy, advantages and side effects of treatment explained, warned that pregnancy must be avoided whilst on ribavirin and for 6 months afterwards. So these notes record that warning being given to you and your wife. What, if any, comment do you have on that?
Well, 2 comments. Only can she's written that, so only she can explain why it was written. I'm very clear. My wife is very clear. We were not told. And the other thing I would question is why there's nowhere in my notes about the meeting where we went down to her with that piece of information. There's nothing in our notes about that. So I don't know why she wrote that. Maybe she thought that she told us. I don't know. But I'm clear we were never told. And whenever we went down to her, if it was me, if someone said to me, if I was in the doctor's position, my first answer would be, well, I told you that. She never said that. So on no occasion did she ever say or try to defend the fact that we were told. And they say, we're two intelligent people. We're not stupid. We were taking all information on board. That when you're 29, you're at that age group and you're trying for children, it's prominent in your mind, so it's not something you would risk or forget.
Now, there came a point at which you discontinued this treatment because of all the side effects.
Yep, it was a pretty haphazard experience. It felt very strange. I was taken off it, and it was a bit, I think some doctors referred to it ad hoc. I remember at one stage that we can't totally stand over results out of that, but again, that's not recorded. So ultimately, I came off it. Very different experience whenever my current consultant took us through the treatment. We're very much informed, very much communicated. My results were communicated to keep us positive around it and very much better planned. This was a very ad hoc, difficult period, and my gut feel at the time was it was too early to go on that treatment. They didn't know enough about it, and that's where I felt that we really were put on it too early. The hospital wasn't set up for it, and it was not, just too early.
You still had hepatitis C, having discontinued the treatment, and still had that when your children were born in 2001.
That's correct.
And how did your knowledge of your infection affect your relationship with your children and the care that you provided to your children, Paul?
So, well, over the period of time, it became more evident through what you read, what you're self-taught, that hepatitis C was a risk. It was a blood risk, and in our notes, and I think we may even still be classified as a public health risk, which is not really what you want to be described yourself as. But we're very aware that you can contaminate, despite Dr. Main's initial explanation that we couldn't. It was evident at that stage that cross-contamination is possible. You can't, it's a blood-borne virus. Therefore, we had to be very careful with twin boys. So you can imagine it's pretty tiresome managing twin babies. So everything we did, and every time any of my blood was open or dropped, we were very clear. My wife was OCD around cleaning, sterilising, making sure the kids weren't contaminated. She put herself at risk with no issues, but we didn't want it, but never put the kids at risk. So the other issue, because I had eczema and the skin conditions, I was bleeding everywhere. Sheets, still this day, you get up in the morning and the white sheets are spotted with blood quite a lot, and that happened. So my blood was always open, and my wife was following me around the house to protect the kids, to make sure everything was sterilised, that there was no risk in contaminating the kids at any stage. And that was a real focus of our lives and bringing up our children.
You describe your stance in your statement this way: I was extremely paranoid that my twins would become infected. And there was always an air of anxiety, and procedures involving extreme caution were adopted.
Absolutely. So, yeah, so you don't say everything. So I don't shave, I use electric shaver. Very, very rare occasions where you use a blade, because if you use a blade, you'll cut yourself. So toothbrushes you had to be careful of. I say any time I was taking an injection, the kids were kept well away, that there's no blood. We have sharp bins in the house, and the needles and all were kept well away from them. And say any time at any form of cut or open wound of any sort, that we're, like any parent, you want to protect your kids first and foremost, and both of us did that as best we could.
And your wife describes in her statement not wanting to have the children in bed with you for fear of infecting them, not wanting to touch their dummies or prepare their food when they were little, again for fear of infecting them.
Yeah. So that's as I say, particularly at night, my skin problems, whatever, and you know yourself. Try to get kids over to sleep. You tend to bring them into bed with you. That was to be avoided with me, because it was just to be a fear that they would get contaminated in some form or fashion. Now,
in around 2011, your current consultant, Dr. Benson, or your then consultant, Dr. Benson, discussed a further course of hepatitis C treatment with you.
That's correct.
And
yep.
You embarked upon that second course of treatment at around that time.
Yep, I started, Dr. Benson was very persuasive in a nice way. I got the message from him, if I'm being honest. So over the intervening years, I kept offering me treatment, and I said, I'm not prepared to go through it again. And obviously we wanted to have a family, we wanted to have a normal as life as we could. And the bad experience I just could not face again. And the other, there was periods of time where there was no consultant in place, and when one of the consultants who was there for a short time, she offered me the treatment, didn't force me. There was no forcing going on, but it was Dr. Benson was quite clear, and I got the message from Dr. Benson that going forward, if I wanted to possibly stay alive, I needed to take the treatment. And so I did.
This course of treatment, you've said in your statement, was also very difficult, but the hospital was more proactive and you received great support from Dr. Benson.
That's
you
correct.
Still experienced side effects, is that right?
Yep. So today I still have skin problems. I now have asthma appeared somewhere along after the sarcoidosis. I've had asthma problems. I have skin problems. I still have bowel problems. Tiredness comes. I still suffer from fatigue. I go to work. I do my best at work. I come home and many times I just sleep after work. Sleep at weekends. So fatigue is still in the background as well.
But you stayed the course, or you were able to stay the course for this second course of treatment, and what was the outcome of it?
So I cleared Hep C. Again, it was the difficult part of this one was that so I cleared it, and I cleared it about, so you went on for 48 weeks. I say that the day I started it, my mother had dementia, and I live in Derry in Belfast. It's about 90 minutes away. And literally the evening of my first injection, I got a phone call from the Royal Victoria Hospital to ask me to come down and mind my mother, and that was difficult because say she had dementia. She was brought into hospital, and she tried to escape from hospital. And when I had a dilemma: do I give myself this injection, because it was a big build up to starting this treatment, so not easy. And literally at 8, we remember it well, my wife and I, at 7 o'clock, we got a phone call to say, we need your help to mind your mother. And I was said, I'm supposed to start this treatment, should have stopped it, should have not started. And I phoned my brother at the time, and we debated what to do, but we started the treatment. I injected myself, went down to the hospital. My mother was being minded by bouncers, for want of a better description, in the hospital, because she was trying to escape. Her mind had wandered. She threw me a right hook, and everyone knows my relationship between my mother. So,
Paul, in terms of your health since then, since the treatment concluded and the hepatitis C virus was cleared,
yeah.
What's the position in terms of your current health?
So, well, I still have a lot of skin problems, diarrhea problems, and the tiredness. The blood results look okay, touch wood. The basic blood pictures that I go to hospital. I'm severe haemophiliac, so I do go every 3 to 4 months. Have done my whole life. So I see the hospital a lot. I see it regularly. So my blood results are currently good, but what concerned me around that is that my brother, he was 3 years older than myself. So after university, he went to England to work. So he's treated under St Thomas's. So my brother also had severe haemophilia, had Hep C, went through a treatment, cleared it, but unfortunately in 2014 he died very suddenly. He got very unwell within a matter of weeks. He went into hospital on a Friday. They struggled to diagnose what was going on. They debated whether to do a liver biopsy because it's very risky for haemophiliacs. But got to the stage where he's going downhill very fast. They got a phone call on the Wednesday to say he had a form of cancer, but it was treatable and was going to go to a different hospital in London for care. On Thursday night, that changed dramatically. Say that further results came back, and he had different form of cancer than they thought initially, and that he's been sent to palliative care. So he died that night within a short period of time. So my real concern here is that, he looked good, his blood results looked good, but within a matter of weeks he died, and he had cancer in liver and stomach, and some of those can be related to the Hep C. So that's my concern. So he never had a thing called fibroscans. We've never had fibroscans here. We're totally unaware of them until maybe 6 months ago, when some of the infected blood inquiry and people were discussing about getting these scans. So.
And what's the position in relation to you having or being offered a fibroscan, Paul?
So I've never been offered a fibroscan. So in November, after previous experiences with doctors, albeit with brilliant experience with Dr. Benson, my wife goes to all the appointments with me, and we discussed, we had heard about others in Northern Ireland getting fibroscans. Why weren't we getting fibroscans? Because we carried a virus for 25 years, we cleared it, and all the material you read, there is a possibility that your blood results can be fine, but there can still be underlying cirrhosis or scarring of the liver, and next to a biopsy, the fibroscan's the best thing. So I never had it. So in November, I asked my consultant, could I get a fibroscan based on what I had learnt? He agreed. He said, I agree, I think you should, especially based on my brother's history. He said he'd contact the Royal Victoria Liver Unit, and apparently there's one fibroscan unit in Northern Ireland. So I had no word. He did email me about December or January time. He kept me communicating. He said it's still no word. Doctor, they agreed they would give me a scan, but still no scan. I saw that Mr. Gary Benson about 2 weeks ago, and he said, look, Gary, I've still no scan. He said, well, they've agreed to do it. So Friday last appointment arrived, and I've got a scan for next week.
Your fear, or one of your fears that you describe in your witness statement that you live with, is that although your second course of treatment cleared the virus, and in particular because of what happened to your brother Des, your fear is that your liver may be damaged and that you may develop cancer in the same way that your brother did.
Yeah, it's an unknown. I say, my whole life, if you think of the decades of life, we started with haemophilia, and that was a cloud, and you managed to treat it. Then the AIDS came along, you treated it. CJD came along, and that was another cloud, and then the Hep C was a major cloud, and we've moved on, but there's still clouds coming, and there's still a lot of unknowns, and it's a fear, and it lived with me. Deep down, I remember saying to my wife, you know, my first objective in life was to outlive my brother, so he died at 51.
You've just mentioned vCJD, Paul,
Yep.
and you've referred to that in your statement. Could we have up on screen, please, 1333007? So this is a letter that you received in February 2001. And if we look at the third paragraph, you were informed in February 2001 that you were not exposed to any of the affected batches in question.
Yep, that's correct. This letter came out of the blue, arrived at the house to say that, you know, and obviously, again, the media was informing you of a lot of stuff, and CJD was prominent in the media. And this letter, we never thought about it. It came, but it was good. Clearly said you were not exposed to affected batches, so it was a worry. There was no worry there, so that was very clear.
And
I was happy with that.
So, and then if we have up on screen, please, 1333006. We'll see this is a letter dated the 20th of September 2004. And we can see in the second paragraph it refers to the receipt of clotting factor concentrates between 1980 and 2001. And then it says in the third paragraph, this tells you that as a public health measure to protect people from the very small risk of developing vCJD through blood or organ donations or through reusing contaminated surgical or medical instruments during certain procedures, you're being asked not to donate blood, organs or semen eggs, to inform all healthcare professionals who treat you about the possible need to use disposable instruments. Mm-hmm. And then if we just have the next paragraphs, please. And then 2 paragraphs further down, you'll see it says, as you will see from the enclosed, we're offering to see any of our patients who wish to discuss their own situation, including whether or not they received such batches. So having been told in 2001 you hadn't received any of the affected batches, what was your reaction on receiving this letter some 3 years later?
Angry. So it arrived at the house. My wife, I say, with twin boys. My wife was literally sitting feeding the kids at the table. This letter came and she opened it up. And bear in mind, the one 2001 said, you're not exposed. And this letter, so when you get a letter like this, if you want to know whether you've been exposed to CJD, please tick a box. So your first reaction is, well, the previous one said we weren't exposed, so you must have been exposed. So immediately we were scared, we were frightened. All of a sudden we had a family, so it didn't just have ourselves to look after, we had family, and you know that becomes more important. So, and then we got this letter, and our immediate reaction was, he's been exposed. Really angry the way it was done, and to say, if you want to know. So basically the hospital knew that I wasn't it. As it turned out, I wasn't exposed, but yet they sent us a letter which frightened you, which indicated, and to me, any reasonable person reading that saying the probability here is you have been exposed. So to me, this was a shocking letter. It was a shocking process of how we were communicated, and we immediately made an appointment. Rita, my wife, phoned our family and asked could they mind the kids, that we were coming down to Belfast. She broke down over the phone. I came out of work. We went straight down to Belfast, and people minded the kids. And we had the discussion with the doctor at the time, and she said, well, if you want to know, I know it seemed very dramatic. She went into a safe, into the back office, and came out to say, you haven't been exposed. So at that stage, we had a very strong discussion about how inappropriate and wrong this process was. Because, at the end of the day, anyone in any form of medical illnesses or contact, people go for breast scans, they go for other cancer scans, and they're not told. But we know, we the doctors know, but we're not going to tell you unless you tick a box and come down and ask to be told. So we had a heated discussion about the appropriateness of this letter, and the only rationale, which to this day I can't accept, was it was to protect those that were exposed. And what reinforces me it's such a wrong process is that in recent months we've met people who were unfortunately were exposed, and you talk to those people who have been exposed, and they live every day, every night in fear. If they have a cough, they feel unwell in any form, they think, is this CJD coming upon me? So I didn't need to be exposed to that because the doctors knew that I wasn't. They knew that I was clear, yet they sent a letter out in this process to simply scare you and to tick a box and arrange an appointment. I'm glad we did. We did the right thing. We just phoned up, we're coming now. You have to see us this afternoon. And that obviously relieved us quite a lot, but I get very, very angry at this process because it's shocking. And I think it was a national process, and again we were told that a group of doctors have been deciding for months on how to tell us or how to handle this. So I said, so you knew for months, and then you still sent out this letter? It beggars belief in my eyes.
I just want to ask you a few questions about the impact more generally that your infection has had upon you. You've described the impact upon your physical health.
Yep.
You've described the impact upon your family life. How's it impacted upon your relationship with your wife and your wife?
In many ways, it strengthens your relationship when you go through difficulties. You get closer and closer. But it's difficult. We've been exposed to one. Most people in life will not face one of these issues. And I'm no different from a lot of people in this room. We're continually exposed to major life-threatening events, and it's continual. It's a whole my life. I go by decade by. That's how I remember things. I've got a wee prompt card of dates, and it's decade by decade. So I had no choice in the matter. My wife, unfortunately, signed up for it when she married me. So it's difficult. We both have to manage. It messes with your head. All these things mess with your head. So we have to manage that in a day, and you're trying to lead a normal life. And we think we need a normal life, but when you talk to people, they realise that's not normal. But for us, it's normal. So I say.
What's the impact been on your employment and on your career in terms of the choices that you've made?
Okay. So I've been very fortunate with my employer. They've been very good. I'm a senior manager in a global manufacturing company, and they've allowed me the time off when I've needed it, and I'm very grateful for that. I went pretty fast. I was quite successful at quite a young age. I became a a technical team manager at a very young age. I've got quite more and more senior roles on site, but it came to a point where I've outgrown where I am. But in the normal role of progression for someone like myself, when you're in around 40, you probably transfer to bigger roles off site, maybe more global roles. And you're given a choice. So at that stage, I had to say, no, I have to step out of this process because, well, I didn't tell my employers too much. I just said, like, I have to step out of this. I know that, you know, with my health, I could not be travelling around the world and moving around the world. So it sort of essentially stopped my career at that stage. So although I've very good and I enjoy my work and have good workmates, probably I haven't got a promotion. So I got numerous promotions, but up until the age of mid-30s when I had to step out of that career ladder and probably haven't had a promotion for 16 years. But my company's been very good to me. They've helped me go through these difficult periods, and I say I do my best. It does impact you, and so another difficult experience was when we were going through the second round of interfering. Because of arthritis, I have limps. I have 2 ankles and dodgy ankles, and I need surgery. But at that stage, when your head was trying to cope with interfering, there was a picture of myself with a local club in a newspaper where I try to help out with sports jerseys and that kind of stuff. And there was a picture, and we got a letter, a card, mocking my limp, and that was really, impacted my life tremendously because I was going through this treatment, and other people would see it, and so unfortunately, I was getting these this letter to the house, which was shocking. But what it did, it reinforced the fact that you have to be so private about your health. And this major decision for me here do I go? It's the first time I've told my story publicly, and that's been massive. I've worked with good people for 30 years, and most of them don't know this. Only a couple of my very close friends and my sister and my wife would know this, well, half of our story. So for me, this is a major decision to tell your story in public, because and more importantly, put your kids at risk to get mocked. So I don't mind. I can handle it if people want to mock me, but when the mocker and what affects your family, it becomes a different story. So in my workplace, I say I've had to step out of that career ladder, and I try to keep very, very private, because I don't want we live in a small city, I don't want my kids affected.
And one of the financial impacts you've described, as well as the indirect impact of not being able to take up the promotions that you might otherwise have wanted to do, is you've not been able to obtain critical life insurance, and you've paid higher insurance premiums as a result.
Yep, that's par for the course. I think there's more rejection letters in my notes from insurance companies. Obviously, first of all, the AIDS is a red flag, then the HCV, hepatitis becomes a red flag, and vCJD becomes a red flag. So insurance companies don't like haemophiliacs.
And what's the impact of your infections or any perceived public health risk been on practical things like dental treatment or other forms of medical treatment?
Okay, so I think dentists are sadists. I'll get that out up front. But so we had dentists. We always have to attend a hospital dentist. And I had one dentist for a majority of my life, maybe 30 years. And because I bled, because of haemophiliac, his treatment approach was when I had to get extraction, I had to get fillings and whatever, there was no freezing. So I remember going, my wife we laugh at it, but the only time I got nervous in the hospital was sitting outside and holding on, sweating before you go into the dentist, because I wasn't getting any treatment was done without any freezing or whatever. So that drill looked massive when it came towards you. But as that was the initial treatment, when the hepatitis C and vCJD became on the agenda, it changed dramatically. So I noticed in some of the previous inquiry discussions in England, they talk about the dentists coming in a spacesuit. In Northern Ireland, they came in a bomb disposal suit, and that's how I described it. They were dressed from head to toe. Every piece of equipment was covered. We were always the last appointment. And I understand, you are a public health risk. That's what we're being labelled. I understand that. But it messes with your head. It definitely messes with your head. But we have, in fairness, we have dentists. We have the current doctor. There was a period of time dentists wouldn't touch us because they, for vCJD, had to bury the instruments after they used with you. And there was a period where, no, we're not even looking at you. You won't get an appointment. We didn't get an appointment. But maybe as emotion disappeared and fact overtook that over the years that the doctors now has us in a regular clinic and we're being seen by the hospital without the bomb disposal unit. Still the last appointment, but without the bomb disposal stuff.
And you've also described in your statement how when you required gastroenterology care and a biopsy procedure, again, you had to go into isolation for the purposes of that procedure because of the hepatitis C infection.
Yep. So part of the investigation is the why, and we've never got to the bottom of my gastro issues, but I did a blood test and it indicated that I was celiac, but the follow-up to that is to do a biopsy. So normally people will go in for an afternoon procedure, whatever it is, I don't know, but I had to go in the night before to our local hospital, and I was shocked because I was brought into never been in an isolation unit in my life. I felt relatively well except for these ailments, but I was put into an isolation ward, which is bleak and scary, and never saw anybody till the next day. So my wife came, and that was it. We sat and we actually looked out the hospital window, and I could see my house about half a mile away, but I was locked in there, and it felt unclean, and that's the way you were treated. I understand that, you don't want contamination, whatever, but it's not a nice feeling being put into isolation units.
And have you ever been offered any form of psychiatric support or therapy or counselling in relation to any of the issues associated with your infection?
Only now, because the inquiry has opened up, the last week we were offered by the haemophilia clinic, or 2 weeks ago, counselling, and my local GP had probably a difficult period over a year ago. Started over a year ago, and I had meetings with social work who's been very good in the haemophiliac unit, and went to my GP and he offered, but so that's only in the last 12 months. Before that, never.
Paul, can I just ask you a little about your experience in asking for or applying for financial assistance? You were told at some point by the hospital, by the Royal Victoria Hospital, about the Skipton Fund. It was the hospital that drew it to your attention.
Yes, Dr. Benson told it. I knew nothing about it until Dr. Benson told us about it.
And you received a stage 1 payment but weren't entitled to the stage 2 payment.
That's correct.
And you now have the Northern Ireland Regional Business Services Organisation scheme. What's your experience, if any, been in relation to the new scheme?
It disappoints me because, in my mind, there's nothing more unfair than treating equal people unequally. And within Northern Ireland, we're being treated differently from other parts of the UK. So there is no special category mechanism that is in England. I don't know what's in, and Wales have come out with their different proposals, and Scotland have their different proposals. Northern Ireland, if you go onto the English website, there's quite a lot of reasonable information about what you're entitled to. If you go onto the Northern Ireland site, you'll see nothing. But again, so the scheme that's proposed here, well, in fairness, the guys who manage it have been clear and consistent, but it's very different from what you've got elsewhere in the devolved nations. So again, we're being treated differently as everybody else, and I think that's not right.
Paul, those are the questions I have to ask you.
Okay.
Is there anything further that you want to say?
I think, it's great, the inquiry, 30 years too late, we all know that, we'll not go back over that, but we have to stop this from happening again. It can't happen. So we have to me, it's very much we have to learn, we have to get to the bottom of this. Doctors have been put in positions, which I believe, unfair positions, where they've had to tell us, we've only got contaminated blood or dirty blood for you. They should never have been put in that positions. I would personally, I'd like to peel the layers of the onion and see how far back this goes. Who was it that decided that we shouldn't be self-sufficient in bloods? Who pulled the funding from that? Because we can't let this happen again. The other thing that really rocks me is people are still dying. 30 years after being infected, as 1 in every 4 days, someone's dying from hepatitis C. It could be me. It could be anybody in this room. But why in this day and age is that happening? It shouldn't happen. And we have to we have to use this inquiry, have to get the bottom of it, and have to stop it from happening and continuing. And special word out to a lot of widows out there. They've been they've been left on their own. Like my wife, she signed up. Well, she didn't know what she was signing up for. They didn't know what they're signing up for, but they've been left on their own. They've been left with no support and no help. And I have a sister-in-law sitting in London, and this is, she's on her own now. She married my brother with plans to have a lifetime partnership and probably grow old and grow old together. And that changed in inside 2 weeks. And those widows, it's very, very difficult. I feel lucky because I'm reading my notes. I go to these meetings and there's widows, there's siblings, and there's children who never knew what went on, and they're reading their dead family's notes. So I feel lucky. I keep saying lucky. Other people laugh at me when I say it, but I do feel lucky. I'm reading my notes. Others aren't. So we have to stop it.
Paul, thank you. I'm just going to ask Mr. Snowden, who, as you know, represents you, if there's anything else. Well, there's just one matter that Mr. Snowden asks that I raise with you. You've told us about the discussion you had with Dr. Main at some point in around 1987 about different types of blood products, safe ones and ones that might have been contaminated, and how they were going to be used. Was there any further discussion with you at that point by Dr. Main or anybody else about any risks involved?
No, funny, I discussed this with my wife this morning. I don't think we had a say in the matter. We were being told, you're getting, this is what you're getting. And you have to, I'm not saying like it or wasn't in that form of discussion, like or lump it, but there was no options given. We were just going to get that. And I think the doctors were coming from a point of view that you needed the factor VIII more than you needed the risk of another virus, and that's debatable, but that's the position I think they're coming from. So no, there's no further risks, because again, back to what Dr. Maina told me, this, you probably had this your whole life, it hasn't affected you, you'll be okay. So I think, and I believe she's being honest and genuine about that at the time. That's what she believed, and transmitted that to us, and that's what stuck in her head. So again, at 1987, the risks they didn't seem prominent at that stage. It's only as probably in the 90s that we really realised this is going to kill you unless you do something about it.
Thank you. Thank you, Paul.
Thank you very much indeed, Paul, for opening up to us as you have.
Thank you.
Thank you. Well, we'll take a break, shall we, till just before 12:30, say 12:25.